Hi, good morning, Debbie.
Well, hi, Amanda. Good
Thanks
to see
for
you.
giving me a little time. I know the clinic is always really busy. I see a lot of people sitting out there. So
Today's a busy day for us.
is it? Yeah. I was wondering how involved, as you being the nurse practitioner in this practice, are you with the protocols or procedures?
Well, I know most of the time Dr. Kella, he likes to be the one to establish those when they're first being set up with a company. And then he lets me, if there's any questions, once you have patients on service, he lets me handle a lot of those questions.
Well, going back to that, I wanted to ask you, like, what procedures is he doing mostly recently?
Resume is a big one that we've been doing. Also, of course, he has his surgical procedures like the TURPs and, but I think as far as any others, it's just case by case, but those would probably be
And
the
a
big
lot of
ones.
those go home with catheters?
Yes, they do.
Okay, and then you do come back a few days, or have them come back in a few days for a
Right,
voiding trial?
right. Sometimes we might get calls that there's problems. Maybe the patients get a little alarmed because they see, more blood that they expected in the urine. And, so we may get calls about that. Or sometimes there's pain issues that they're just they weren't prepared to have. And, even just having that Foley catheter in place can be a little annoying to some of them.
Provoking, for sure. Well, I want to talk to you a little bit about ways that we could help, because I'm also wondering, like, how many days that you have to set aside for those voiding trials. Takes a lot of the clinic time.
Right, yeah, they'll come in usually on the 5th day after they've had the procedure. We'll be in touch with them, and then once we start, we tell them, come in, we'll take the catheter out here in the office, you're gonna have to sit a while, so they, it does keep our clinic very, very busy especially if there's, a couple of them or 2 or 3 patients involved with those procedures.
Right. Well, a way that we could help is actually setting some protocols with Dr. Kella. Ways that our service can help is that our nurses can go out there like the day after just to ensure things are going okay. Then we can do that voiding trial in the home. And I know that, I don't know what you've done in the past or if you've worked with other companies, but that's something you can't bill for, right?
Yeah, no, we can't. They just come in and we just have to fit them in our schedules as other patients are here.
So that could free up clinic time for you, and we could do that in the comfort of their own home. I've had some patients that I've worked with on this before, and a lot of them are relieved that they don't have to come back or they don't have to go out with that catheter, because a lot of them, they're staying home for those few days after they have that catheter. So they don't have to go out and come back to the clinic to do that. With the catheter management too, is we can answer a lot of those questions about some of the sediment and whatnot that they might see. Our nurses are really trained in doing that to field those calls. That way you don't have that many calls coming to you. Of course, we also have tools that we try to empower the patient with. One of them is our zone tool, where they know if they're in the green zone, they're doing okay. If they're having some of these symptoms, that maybe they need to call the nurse. I'm in the red zone, that would be ER. Of course, we have a 24-hour nurse that can take calls too and can guide them through that too.
That sounds really good, Amanda. So y'all actually give these to the patients?
We do. This goes in their home and they can have this. And even if they're in the yellow zone and we think that they are showing some symptoms of maybe a UTI, we can pull those labs if we can write a protocol with Dr. Kella. So that's really what the purpose of coming to talk to you today. I was hoping that perhaps we could talk to Dr. Kella in regards to getting some protocols with us, so that way we can get his do's and don'ts for those days that we're seeing those patients, and that that would alleviate some of, like I said, the clinic time, the questions that you might have to field in your clinic, I know we've talked before that you see a lot of Medicare here too. So it's 100% covered benefit for the Medicare patients. So
Oh, that's wonderful, especially since, like you mentioned, it isn't anything we can bill for. That's going to free up some of that time for us to bring other patients in. So I think that really sounds like a great option for us. Let me talk with Dr. Kella because I know he's out today. He has some surgeries that he's doing today. So let me see if we can go ahead and schedule time to set up protocols. I think he would be delighted to do that, and all this about the voiding trials, as long as your nurses are familiar, I think he would go for that.
Absolutely.
So I really like that.
And
I'm
the
sure
other
he
thing
will.
is if we get a protocol, is that can be a standing order. So then all I
that's
would
true.
need is just
Okay.
like the demographics and a clinic note, and then I have a standing order.
Okay.
So I'm going to follow up with you. You say he's out today.
Mhm.
He'll be back tomorrow,
Tomorrow.
I'm guessing.
Mhm.
So if I can follow up with you at the end of tomorrow,
Okay.
that would be great, because
Yeah.
I would love to have something on the books too. That way we can get this started.
Okay, yeah, then let's do that. Yeah, if you want to call out around 1, because that gives me a chance to talk with him in the morning, and 1 o'clock's a good time. If
Okay.
you want to call me then.
Okay, thank
Okay.
you so much,
Yeah,
Debbie,
thanks for
your time.
stopping by. Can I hold on, please?
Actually, this is my only copy that I utilize to show
okay.
all my different clinics too.
Okay, well, I'll tell him that you'll share all that information.
Absolutely. All right.
Okay.
Thank you. Have a great
Thanks.
day.
You too. Bye-bye.